Hello again and welcome. Last episode, we heard from Dr. Dario Minaya, CEO and CLO of Minaya Learning Global Solutions, and Sanjay Katyar, co-founder of Knowledge Synonyms, as they spoke on an innovative tool for competency assessments and a healthcare use case demonstrating measurement and evaluation in healthcare. Moving on, in this episode, the conversation continues on workforce development in healthcare with Susan Minaya, COO and Chief Learning Strategist with Minaya Learning Global Solutions, and Scott Winter, CEO and Chief Curator for the Collaborative Commons and also a member of the MLGS Healthcare Practice. Their conversation will focus on organizational performance and culture building in healthcare. Stay tuned to learn more.
Well, Scott, I want to thank you so much for joining me today to talk about healthcare and organizational development within the organization. You and I, for probably the last 4 years maybe, have been really working together with healthcare organizations. And you also have a lot of healthcare organizations that you work with independently. And I think, this is something that working side by side with you, I know you have such a passion for, which is why I'm so excited that you were able to take time to talk with me today about healthcare organizational development. And, what I really kind of want to start with is this question around what's the biggest issues that healthcare organizations today are facing from your perspective?
That's a big question. I would say, first off, that, as you know, I think it was Peter Drucker that said healthcare organizations are the most complex type of organization that exists. And that was way back when he was doing his work. And I would say today, they're even more complex, to your point, around all the issues that they have to face. Not only is it dealing with, their own regulatory and being compliant, but I think just the demand on the system, as we've seen with COVID, that there are just so many factors at play that organizations must kind of work through to make sure that their systems are aligned. That in order to do that, then the people who are working on those systems need to be able to work together. But I would say that some of the biggest issues is we have a lot of healthcare issues that is just putting a huge strain on the system, and having that as a driver for change and helping people shift out of the acute care kind of model to this population health model is a big paradigm shift, trying to give the patients and the public a more proactive approach to how they take care of themselves to minimize the impact. So I think part of the big challenge is that there's a huge paradigm shift unfolding, and I'm not sure if the systems are ready for it.
Yes, and you talk about that. So much is at stake. There's lives at stake, right, in the healthcare environment. So, and even with things like population health too, it's like the need is so great, right, in the communities that the healthcare organizations serve, and it's only getting more monumental, the demand for that. And I think that it's like, how they move fast enough to be able to keep up with that demand, I think, is really where a really huge challenge is for them today.
Yeah. Well, I mean, even in our own community, we have such a high level of chronic stress, poor access to, food and good nutrition outlets, that I think those factors within the community also, again, that's why I think hospitals are trying to be more proactive, more preventative. But it's trying to shift public behavior is really a challenge. And so I think that's part of what they're up against. And they're part of a bigger system, whether it be policy with policymakers, with public health, with education. They are a part of a bigger system. And I would say healthcare's ability to collaborate with those different players is going to be growing more substantially into the future.
Yeah, it's like, it's super challenging. And I think anyone who's in leadership roles in healthcare organizations really, they've got to definitely have vision, right? But yet staying power, like the ability to be able to really continue to follow a specific path for where they're trying to get to, because, some these are things that don't happen. You don't change public behavior in a heartbeat, right? So it takes time to be able to do that, and also keeping that focus on your eye on the prize, if you will, and having the patience and the tenacity to be able to stick with it to realize the vision, I think.
Yeah, I mean, on that point too, I mean, as you know, Susan, I play a little bit in the neuroscience space, and there's this
Mhm.
term called interoceptive awareness, which is our brain's capacity to predict. Well, our brain's a prediction machine, and it's making predictions based upon our past experiences. And again, I think that's the pressure point between being able to really understand what the future holds for healthcare, and then as leaders and decision makers that we're actually prepared. So again, been a very reactive model, rather than a
Yes.
proactive model. And I think that shift is really taking place, but we can't necessarily solve the future's problems with our current way of thinking. And I think that's probably one of the biggest challenges that I see. And so I would encourage, like in some of the agencies that I work with, doing, simulations and really doing, kind of a picture of what 10 years looked like, in worst case scenarios, so that we can start to prepare our systems for things that we currently view as unimaginable or unbelievable. We got to make those things believable, and we got to adjust and think in ways that are, again, proactive rather than reactive.
Yeah, definitely. So that takes me to really the next topic I wanted to talk to you about is what really gets in healthcare organizations' way. Like, how do they get in their own way? And this is work that you and I have been doing with different organizations, and I think we have some common thought around that I really wanted to hear from your perspective. How are they getting in their own way so that they can't really do things differently, right? Than to get where they need to be for the future.
Right. Well, I mean, in the work that we do around collaboration, a big part of it is, I think there's like, because it's so complex, and you have these different departments, and they have their interests that they need to meet for their own group. And I think some of the silo mentality is a big obstacle, because all of a sudden I'm being an advocate for my department, and I don't understand that it might have a ripple effect through the entire system. And so I really encouraging a shared set of interests that as a system we want to uphold, and then really be able to work through the positions in more collaborative ways. So culturally, having that kind of clarity would allow, I think, leaders to be able to have a different framed conversation. Because we need to get the resources to provide, and if my department it doesn't have the human resources, that becomes a challenge. And as you know, because of COVID, there's been a huge strain. A lot of healthcare workers have left, and I think, as we're seeing across the country, the other big healthcare issue is that they're trying to do more with less, and I think that's a real challenge.
Oh, for sure. And never mind, like with the talent issues that they're facing, right? More with less, not
Right.
because, they just can't get the talent. And that's just going to continue to be a challenge, I think, going forward. But yeah,
Right.
the silo thing is something that I've really just noticed significantly. And it's hard to break that kind of mindset. So that systems thinking is really, I think, kind of a concept that is, while it wouldn't seem like it would be, but it is, because there's so, in healthcare, they're so dependent on the handoffs and the pass-throughs and things like that they would be more cognizant, if you will, about the impacts, downstream effects of the things that they do. But interestingly, when it comes to like operationally speaking, I think that's where I see big challenges. And I think for me, another place I've noticed is just, in some ways there's like process, but there's not just some of the most general of processes, right? It's like kind of doing the same things, always back-to-back meetings, never having time to actually or thinking time, right, to do the work that needs to be done. And I know you and I have talked with different organizations about that a lot, about how do you change that dynamic so that I can't just go from meeting to meeting to meeting to meeting with no break or no lunch or no bio breaks or anything like that. How can you get ahead of that? And some of it, I think I've heard you say before too, is really about, you don't have to be in everything, right? And so where is our mindset on succession planning, or building capability in our teams to be able to do things so that we as leaders can breathe and have time to
Well,
do that focused strategic work we should be doing?
Absolutely. And I think that's, as we've shared with our clients, stress in any system or anyone's life is when demand exceeds capacity, and the demands are, growing. Our work is about how do we develop capacity? First of all, can we, to your point around priorities, if everything's a priority, then nothing's a priority, right? So what do we need to be focusing on to really define the demand in a very practical way? And then secondly, how do we build that capacity, both in terms of our processes and systems, and also our people? And to your, I think kind of what you're alluding to as well is that just the sheer level of stress from an individual's capacity. Because again, we always talk about how a rising tide raises all ships. And if an individual is not sound in their way they practice, or they're overly burdened by maybe lifestyle or maybe workload, then their capacity gets eroded, and that can have a ripple effect within teams. And so again, I think there is the stress that is somehow there, trying to figure out how to manage my stress so I can help other people be better, so that we can work on these processes that are stressing us out. But to your point, we're not spending the time working on the organization so we could be better in the organization, because we're constantly having to put out fires. And so making that shift, I think, is a really hard thing to do, especially in healthcare. And if you're in a smaller system, it makes it even more challenging. So
Yeah, definitely so. Yeah, well, thank you for that. I think this is something I know that we continue to try to help the people that we work with to be able to find ways to open up that space, I think, for leaders. And I've really enjoyed the times when we've done innovation type sessions with people, and how much they enjoy that time to be able to really kind of think of how might we be doing things differently than we are today, so that we get the different kind of results and outcomes that we're looking for. So, and I think, some things like we've done, like Fresh Biz game, really does get people to kind of see how you kind of move your mindset out of that siloed thinking. So that's been pretty phenomenal, some of the results that we've seen from there.
yeah, and there's a tension. There's a creative tension. I think oftentimes trying to help people think through that. Often, within the context, we like to say, like, if life and business is a game, in the sense that we play by a set of rules, and we all have a set of assumptions. Then, if we don't like the game we're playing, we can change the game or change the rules. But I often see too that a lot of times we plan around the rules and not being clear on what is it that we're trying to get to. So getting that level of clarity in terms of where are we trying to get to, and be really clear with that, so we can kind of mitigate the noise that sometimes gets in the way. And so if we're going to get to this outcome, then let's play a different game by really trying to figure out what the new rules are. Where I live, we're dealing with a big food systems question right now, by bringing in all the players. And I think the key is getting all the different players that have different interests or different positions, if you will, to come together and sit through to say, okay, what does a thriving health system look like, or a food system look like within our community, in our county? And I think the same thing within a healthcare system. It's like, what is it that we're really trying to get to? And then in order to do that, how do we play a different game to make that happen? What rules need to go away? Or how do we advocate maybe some shifts at the state or local levels to make that vision a more realistic reality? And that's what I was saying earlier, is like bringing in other stakeholders into the conversation, other potential resources that are impacting the system that can help facilitate better health for these systems in their own communities. So it's one of the things where we have to kind of expand the horizon of people's visions of what's possible, and how to play together in ways that make that possibility a more realistic piece. And again, I don't want to be Pollyannish about it. I mean, it's going to be real work, but it's better to start something than just sit and complain about what's not happening. So trying to move them in a proactive way is really key, and I think that goes back to capacity. Are there leaders in place that because they don't know, and they don't know how to collaborate, then ultimately they keep the lid on, and all of a sudden then you get people who are frustrated in the systems that they're in, and instead of being curious and listening to staff and listening to the folks who are actually delivering the work, who have ideas, gosh, if we only could do this, and then blowing it back a little bit, right? Because maybe some of those ideas might have a ripple effect within the system, and that's why one system we created these action teams, and it was a cross representation. And so if it was dealing with reducing nosocomial infections, specifically a couple different areas, and we brought in all the people who are kind of in that wheelhouse to kind of solve the problem themselves. And again, within one hospital, they went from bottom 10% HCAHPS to top 10 within the span of about 2 years, because they really empowered the folks at the front lines. And I think when people are frustrated, and a lot of employees are frustrated right now because they feel so helpless, like the things aren't changing. And that's part of that stress that kind of erodes people's capacity. And so, we got to kind of turn that around, because, people are frustrated because they care. And when they are frustrated, there's a commitment there. And so helping leaders understand, hey, how do we tap into that commitment or that caring, and refocus that frustration into solving problems, rather than seeing it as a jab against leadership, because it's not that. It's just people seeing that things could be better. And that's where that collaboration and the teamwork really comes into play, from a leader's perspective and a team's perspective.
Yeah, it's like, how can I help? And I think, we saw that type of, the people that do the work really helping solve for the issues, right? And one organization that we helped with a professional practice model for nurses, right? So that they really define that, because they did the work. So what's going to allow them to be fluid and interacting with one another in ways that kind of help them achieve and help them in their day-to-day work, was really a powerful experience. And it was very empowering for them.
Yeah. Well, and I think it goes back to that psychological safety that Amy Edmondson talks about in her work. And she's done a lot of work in healthcare, in the sense of that it's not about execution, it's about learning. And I love the way she frames that, which means that we have to create a safe enough environment for our employees to share those frustrations. I remember I was working for a healthcare system that was trying to get a certain status within Plaintree, for example. And one of the areas that was really struggling was the ER department. And I sit down, we're meeting with the staff, and the staff are like, well, it's our job description to take crap from our physicians. And it's like, I don't think it's written that anywhere to say that. But that was kind of the culture that was kind of built in for that particular department. And once the staff realized that they could use their voice, they need to be psychological, and it was really one or two characters, kind of bad apples, that really were causing that glitch in the system, right? So we worked through it, and we gave employees the ability to kind of learn how to communicate. We gave the physicians the framework to kind of work through and think through. And they got the award eventually. And I think it just takes time, but it also means that we have to have some different conversations between all the players in that particular team or that particular organization. So it takes leadership, and it takes self-efficacy from the team members to be able to find the courage in themselves, because we're not helpless in this process. We can all find a way to make a difference.
Yes. And I think which kind of leads me into the next thing I wanted to talk to you about, was because this is work that we've done together, really, and working with groups like that, where you have leaders together, and the people kind of the leaders below them, and beginning this trickle down with people. And one thing I love that you said, and I just never forgot about it, and you've talked about it over and over again, is what are the implications of shifting from oh no to can do? And I loved how you said that, because a lot of times people are like, oh, we can't do that here, we can't do this here, but what does it look like if we can get to can do? Can you speak a little about that?
Yeah, well, again, I think it goes back to the rules conversation. It's what's the assumption or the belief that's making me say I can't do something, right? So it's about testing those assumptions. And so it's, instead of that, oh no, it's let's go, which requires couple things. One is reframing the game in a way that says, here is our outcome. And instead of it being a matter of to do, right, it's about how do I want to be as I'm working through that. And so again, part of the work in what we do in performance science is getting people to understand what state am I in to pursue that, and what's blocking me from doing that. And let's start removing some of those blocks so we can actually make those things happen. But I think, again, this is where that stress comes in. If someone's feeling really helpless about a situation and they don't feel like they have a say, then they're going to say, oh no, here we go again, versus, man, here's an opportunity. Here's a puzzle that I want to be able to solve with my team, or with my leadership, or with my organization. And so giving them that sense of agency, that they have choice and that they can actually do something about something that's a problem. And again, that's what we did with the healthcare system. That when we started with them, they had like 5 focus areas, right? And then, within of about a year and a half, they had something like 50 quality initiatives, all these cross-functional teams. And again, it was like, oh yeah, if they see a problem, they can say, well, let's figure it out. And I think that really made a huge difference, is that empowerment. And again, the whole idea of collaboration too is, people support what they create. And with all the data collection that healthcare systems are doing, I think helping people make sense of that data to turn it into a shift in a behavior, into how we treat patients, into how we then see new data points come up. I mean, that's where I think healthcare has an advantage, because they do so much data work. But helping staff members see the connection between their behavior and their actions, and again, it's less talk and more do in terms of keep testing these assumptions. So let's try that out. You believe that? Let's test that assumption. So engage staff, engage teams into kind of saying, well, if it's going to get in the way, what do we do to remove that? And how we go from that, oh no, to, well, that could be done. It's like, great. So let's get that out of the way. What else can we do? So it's just getting them to see. And then in that process, they're developing some mini wins. And then it just starts to build momentum. And all of a sudden they realize, man, this is my department. Regardless of whether they're an X-ray tech, they own that patient experience. They own their team culture. They own that process. And so there's no one to blame, and everyone takes that self accountability. And again, it's harder, I think, because of the stress, though. I mean, when people are stressed out, they become very self-centered, selfish, about self-preservation. I think there's a lot of self-preservation right now. So helping to kind of mitigate that, bridging from feeling, insignificant to significant is part of the work of a good leader as well. So to bridge that gap, helping those team members find that they have agency, that they have choice in making their systems better for the patient and for themselves.
Yeah, definitely so. And what I guess what always strikes me is that it's never in the teams that we're working with. It's not really about skill building, but like behavior change for practicing. So I don't know that I put it in a formal training type of a bucket, if you will, but it's more really about awareness, self-awareness, about mindset, right, and about choices. Because it's a different kind of interaction for the people that we've worked with than they've ever had before. And it's almost, in some ways, it can feel like counseling, right? A little bit, but just because people need to get things off their chest so that they can create space, so that they can have a different dialogue or a different conversation. And that's one of the things I've seen so valuable, is watching a team that's just super not happy, and then allowing them to kind of put that out there, but realizing through the process, I think that I've watched you take them through, that they're able to identify their ownership and all of that. So, it's not just about a blaming thing or a victim thing. It's about, like you said, we all own this, right? So how are we going to make it better?
Right. Yeah. Well, it's interesting because, as you said, a couple of things that come up for me. One is the idea of, shifting out of, David Emerald's book, The Power of TED, and helping people understand, like, look, are we in problem orientation? Because if you're in the problem orientation, you're just going to activate the stress part of the brain, right? Mm-hmm. Versus, what's the goal orientation, and all of a sudden get excited about that. And I think that's kind of shifting out of, instead of the environment, influencing the way you think, how does your thinking start to shape the environment that you want to be in? And that takes time. And to your point around practice, the other point that came up for me too is, as we integrate a lot of performance science into the work that we do. And so in working with one of our colleagues who works with sports and athletes and stuff, one of the things that really resonated with me about a year or so ago, when he said, when I work with an athlete, there's 2 zones that we're in. We're either in the practice zone or the performance zone. And I'm like, man, it's so interesting, because most companies and most organizations don't really frame it that way. It's either, you go to, this is, again, in the healthcare system, it's like people are showing up to work. So it's either they're in their comfort zone or they're in their performance zone. And so you have to be elevated at a high level. And so at what point do you realize, well, what do we need to be practicing? Where's the practice zone for us? And where do we make the time to do these things so that it just becomes a matter of practice? Because going back to Amy Edmondson's work, all of a sudden I start to learn what's getting in the way of this practice. And that's where when they sit down and say, here's what's blocking me, or here's what's blocking us to be able to practice efficiently, then those little process shifts start to take place. And so, to your point, making it safe to practice and test these assumptions, again, never compromising quality care or patient safety, is really a big part of that. And I think, again, most of the healthcare workers that I've worked with are very committed and they're very compassionate, almost to a fault. And I think that, they want to play and they want to practice how to be an excellent healthcare worker, but sometimes they're in systems that doesn't allow them. It's almost like you see it in education where teachers are inspired to teach and they get into a system that just kind of squashes that dynamic. And so I think sometimes you find healthcare workers with the same level of, commitment coming out of, nursing school, or any sort of health school that they've been in. They want to really make a difference and they get into a system that just beats them down. And I think that's somewhat problematic as well.
Yes. Well, I think I just have to tell you, it's been such a joy working with you and watching the transformation of teams and leaders and organizations, healthcare organizations, be able to kind of really gain that awareness and change the game. And it's super gratifying when you watch the ones that really do carry it forward, right? With the rest of their teams, they begin to trickle it down. And what I love about radical collaboration is the practices it's 5, right? So spin them off for me. Tell me what the 5 is.
So, sure. Yeah. Well, again, if we're going to be practicing, the first one is just having, to your point, or having the mindset of collaborative intent, like going into a situation with that, oh, let's go. Like, hey, I not only am I wanting to win for myself, but I want you to win too. And then, as a team, we can get through this. So that's the first one, just coming in. And I think to your point of just monitoring that, which then the second practice is just self-awareness. And we do a survey around these practices, and it's interesting because most groups that we work with, the lowest score in the collaborative practice survey is the self-awareness because of that stress, right? So really developing that awareness, and again, like I said, I think it's just important to have a to-be list as much of a to-do list, because again, it's not about stress management or time management. It's about state management. And what's interesting, we're working with a group right now that helps using biofeedback tools for physicians and trauma nurses to just help them manage their state and manage the stress level so they can better perform. So that self-awareness is really key. The self-accountability is just recognizing, the choices that I have available to me. And again, in a highly collaborative environment, there's no one to blame and everyone's accountable. And again, when we move into those high performing cultures, everyone owns the result. And I think that's what, again, even with Amy Edmondson's work, it's like in a safe, psychological safe environment, it's okay for me to say, hey, I made a mistake, and then we're going to learn from it versus getting blasted. So that self-accountability of taking ownership and recognizing choice. The fourth one is around openness and how open people really are. And so it's about being honest and open with what's going on, and more importantly, about how people are feeling. Feelings do matter in the workplace. I think a lot of times people are afraid of feelings. So it's to feel something is to understand. And so a lot of the fears that are coming up for people, well, why is it coming up for them? Well, it's probably because if they say something, they're going to be rejected, right? So this is where the social brain comes into play. It's just like, I have to say this, and if I don't, I'm going to find myself really struggling. But my fear is if I say it, I'm going to be rejected, or I'm going to be ignored, or I'm going to be humiliated. And those very real things come up for people. As smart as medical people are, a lot of times, they are so stressed out and they don't say what's going on for them, which then creates that it just becomes compartmentalized or becomes oppressed, and all of a sudden the stress levels go up in the social domains. And then the last one is this interest-based negotiation and problem solving. So, really a lot of times we argue over positions just versus say, well, what's behind the position that you're holding? Because I think we're more aligned. And I would say that when you talk to a lot of healthcare professionals, they got into it because they really, I think there's some lifestyle, there's good pay in the system. But ultimately, I think people do want to make a difference. It takes a special breed of human being to want to go and work with patients who are struggling or suffering. And then, more on the pop health side, just to help patients take and develop more sense of self-agency of themselves. And so again, there's a continuum of care workers out there that I think really care. And I think that's, if we just tap into that's the interest that we're trying to serve as a collective, then let's figure out how we can get our positions aligned, because that's the work, that's the collaboration work.
Yeah, It's great. It's just awesome stuff. And I've loved the journey with you, and, with the healthcare practice, it's just, we're so privileged, that we get to do that work with you too. So thank you.
Well, thank you both for sharing about organizational performance and culture building in the healthcare environment. In our next episode, we'll be continuing the topic of workforce development in healthcare, focusing on leadership development in the healthcare environment. Until next time.